The Ebola virus outbreak is a serious epidemic that is going on in the world today. In all, there are 3,707 confirmed cases, 1,848 suspected cases of death, and 2,106 confirmed laboratory cases. And this is all of August 31st of 2014, so we can see that's been a pretty big epidemic so far. So what is this virus? The Ebola hemophagic virus is one of numerous viral hemophagic viruses. So in all, there are 5 subspecies of it. There's the Ebola virus that I'm going to be talking about, the Sudan virus, and the Typhus virus, the Bundiabogia virus, and the Reston virus. So all these are human contractable viruses except the Reston one, and that is just primates can only contract that one. So the natural reservoir that this virus comes from is not yet known. So it is thought to be zoonotic, which means through animals. And so mainly right now we're seeing the case contracted by bats. Bats have been carrying them back and forth to people and primates. So what are some signs and symptoms of this virus? So this virus is very severe and often fatal. We recognize it when someone has a fever of 101.5 or over. They have muscle pain, weakness, diarrhea, vomiting, stomach pain. They have lack of appetite and unexpected bleeding or bruising. So this normally occurs between 2 to 21 days between contraction, but normally it's between 8 to 10 days. So you can, that's kind of your guide. So some are able to recover from this virus, but a lot aren't. And usually they die without being develop a significant immune response at the time of death, so it makes it hard for us to find a cure for this or a vaccine or anything. So who is this affecting today? The 2014 Ebola outbreak is the largest in the history and the first in West Africa. So we see that it's huge in Africa. It is in Guinea, Liberia, Nigeria, and Sierra Leone. So in Liberia and Nigeria, it's different. So it's more of a traveling case. So that means someone was in Guinea, then they traveled to one of these 2 places, and then they contracted the disease and most likely died from there. So that's what those are from. In Guinea, we see there are 771 cases with 494 suspected deaths. Liberia, there's 1,698 cases with 871 suspected deaths. And in Nigeria, there's 21 cases with 7 suspected deaths. And lastly, there's Sierra Leone with 1,216 suspected cases with 476 suspected deaths. So we can see here from all the stats that this is a very deadly disease with a very low survival rate. There hasn't been any issue with an outbreak in the United States yet, so that's why we haven't really heard much about it. But there are workers who have gone over there from the U.S. that have contracted it. Actually, Dr. Richard Sarkray, Dr. Kent Brantley, and Nancy Whitbell all have been infected with this virus. Dr. Kent Brantle and Nancy Whitbell were infected in Liberia, and then they are transported to the United States for treatment, and they're in isolation. And so that's how the United States have it, but it's all controlled, so we're fine there. So what's the risk of exposure? The risk of exposure is very high because we don't know exactly what is causing it, so we cannot make a vaccine to help prevent it from happening. It's highest in Africa right now, as all these countries I have listed before have, that's where they're from, is Africa. It's also very risk for healthcare workers, like workers who have gone from the United States over there and helping, or just anyone helping these people. Also, family and friends and patients with Ebola, they're very high risk. One story I heard was before they knew about this breakout, people were dying from unexpected deaths and they didn't know what was happening, so they would be like, the people would die, so they would take care of their body, but they would be touching secretions and stuff, and then they would get it, and then they would in turn die. So that was a horrible chain of effect that was happening, and it was very hard on them. So preventions, what can we do? So there's very few preventions and no vaccine yet. So we just do what we can. So just knowing and catching the symptoms before, like as soon as possible, and isolating those patients before they spread it anymore is good. Healthcare workers need to know the barrier nursing techniques, which is wearing protective clothing like gloves, masks, gowns, and goggles, infection control measures, so sanitizing and disinfecting, and isolating patients. So we need to avoid contact with the blood and secretions, as I said before, so we don't touch them. So those are just a few. The CDC actually has guidelines up online you can look at, and there's a list of 9 of them, and so that's a good place to check for the Ebola virus. There's no specific treatments or vaccines or medications yet, as I already said. We provide intravenous fluid and balance electrolytes, we maintain oxygen and blood pressure, and we treat other infections if they occur. There are experimental treatments that are happening, but they are not yet used on humans, only primates, so we aren't sure about those and the safety of them yet. So this all started in March of 25th of 2014 with only 86 suspected cases in Guinea, with investigations in Liberia and Sierra Leone. So as of August 28th, the number has grown up to 3,707. In just 5 months, we see this significant increase, and that's crazy. So because of this huge epidemic that is occurring, I believe we should inform people with this virus about knowing what it is, who it is affecting, and how we can prevent this.